Hello, my name is Amani Maxalls, and today I'm going to be discussing what the policies and politics of health are, their significance, and how they have been influenced by the COVID-19 pandemic. The policies and politics of health are regulations, actions, and decisions that are aimed at achieving health-related objectives and allocating scarce medical resources. Health policies include areas such as health behaviors, exposure to toxic substances and chemicals, costs of health services, health screenings and vaccinations, reproductive health, access to healthy foods, health product and service marketing, and health promotion and prevention initiatives. The policies and politics of health are significant because they influence the labor market, socioeconomic and income inequalities, the welfare state, and population health outcomes. Policies are driven by healthcare stakeholders, politicians, lobbyists, scientists, evidence-based research, economics, and private interest groups. Policies and politics are relevant to healthcare because they influence the U.S. healthcare delivery models and payment systems. Next, I will discuss why the policies and politics of health are important and how they have been affected by COVID-19. Health policy decisions impact the health of populations and determine the regulation of public goods and natural resources. Furthermore, these policies establish mandates that protect citizens from harm, for example, like requiring everyone in a vehicle to wear a seatbelt. They also initiate social service programs, reduce barriers to accessing care, and create opportunities and incentives to enhance the quality of care and change health behaviors. COVID-19 has influenced the policies and politics of health by changing spending priorities, payment models, and healthcare delivery systems. For example, healthcare stakeholders have had to reassess healthcare delivery models and spending priorities because the pandemic has drastically lowered healthcare utilization rates, yet increased the utilization of telemedicine. Healthcare stakeholders and politicians removed regulatory barriers for telehealth adoption to address gaps in healthcare delivery that resulted from the COVID-19 pandemic. More healthcare stakeholders are also beginning to advocate for a single-payer system that makes the federal government responsible for the health of the population in order to reduce health disparities, control the cost of care, and enhance the quality of care. Lastly, COVID-19 has caused healthcare stakeholders to waive certification requirements for nurse practitioners to address the shortage of healthcare workers and fill in gaps of care. Now I will be discussing the issues healthcare stakeholders should keep in mind in regards to the impact health policies and politics have on the healthcare industry. Healthcare professionals should be aware of the rapidly changing health policies and procedures to ensure they are incorporating the best practices into their healthcare delivery models. Moreover, healthcare professionals should be mindful of their biases that exist for certain health policies affiliated with political parties or special interest groups. For example, like the abstinence-only sex education courses. In conclusion, I will be outlining political and policy-related recommendations for healthcare professionals moving forward. Healthcare professionals should try to increase consumer engagement and education on health policy issues so that consumers can vote on health issues that affect them. Secondly, they should advocate for an increase in government funding for comprehensive health promotion and prevention programs. Thirdly, healthcare professionals should recognize the impact policy and politics has on the healthcare industry and adapt to changes in the legislative environment. Lastly, healthcare professionals should avoid partisanship and advocate for policies and reforms that improve the health of the population and reduce health inequalities. Thank you very much. This concludes my presentation.